Okay, good afternoon, everyone. Hello, Colorado School of Public Health and our friends who are joining today for the State of the School 2021. If we could move forward to the land acknowledgement slide. This year, I'm going to begin with a land acknowledgement that was developed by faculty member Jared Ivanich. We humbly acknowledge that the University of Colorado Anschutz Medical Campus is located on the traditional contemporary homelands of indigenous peoples. Our campus resides on unceded lands of the Arapaho people, established to the Treaty of Fort Laramie in 1851. We recognize the enduring presence of more than 40,000 indigenous peoples in the greater Denver area. The sprawling urban American Indian Alaska Native presence in Denver consists of other tribes native to Colorado, such as Apache, Comanche, Shoshone, and Ute community members. It is now home to numerous other indigenous peoples from many of the 570 plus federally recognized tribes in this country. Together, we recognize the history of genocide and ongoing systemic inequities while respecting treaties made on this territory as a step towards reconciliation and strengthening relationships with indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty and right to self-determination. We recognize the lessons, including many medical and public health lessons that indigenous communities have offered and continue to teach us. So moving on to what we're going to be doing today, I'll be joined by colleagues listed here covering the areas of public health practice, education, and research. This year's word cloud, of course, is marked by the COVID-19 pandemic. We, of course, are in our first full year of the pandemic and sadly at month 22 since the pandemic reached us in Colorado and the school in March of 2020. We've had ups and downs with the pandemic as it has pursued its course. If we could go to the next slide, this is hospitalizations in Colorado with our peak of about a year ago at over 1,800 people in hospital and a recent peak where we almost reached 1,600. Fortunately, things have come down, but the pandemic will have a lasting impact on public health. We just go through some of the things that we've seen over the year. The threats to public health professionals, misinformation, problems and challenges with vaccines and vaccination, and the effects on our local public health departments. And now, of course, a new variant that we are concerned about, Omicron. This will be lasting and gives us an agenda as we move forward. In the face of all this, the school, our students, staff, and faculty have continued to have important roles, some of which are listed here. I want to highlight recent work of several of our centers. Moving to the next. Our Rocky Mountain Prevention Research Center with CDC funding has been working in rural communities, developing approaches to address vaccine hesitancy and achieve the needed rates of vaccination. Our Latino Policy Research Center has had a number of community-directed activities focusing on children and adults, working at clinics and doing a great deal to provide bilingual informative educational materials. Our school is reaching widely and certainly has become far better known as a consequence of the pandemic. These are Google media figures on what has happened with our presence. And I think you can see that the pandemic brought a great surge in these activities. I'm pleased that our faculty, staff, and students have been responsive to the broader community and served the media as an important source of reliable information. Interest among students has increased in public health. Applications have gone up 2 years in a row. This is the present admission cycle. And as you can see, a gain of 20%. And Dani Brittain will subsequently provide a longer term trend of growth in our educational enterprise. Our faculty has continued to develop and grow. These are some individuals newly appointed to positions within the faculty, along with, on the next slide, external faculty recruits brought in as well. Our faculty are doing well and have been awarded for their contributions. Here are just a few of those. I highlight Spiro Manson, who has won several prestigious national awards, Donna DeBelia, named Distinguished Professor, Kimberlyn Cook, Outstanding Student Award, and more as we go to the next slide. So additional awards that have been received. So congratulations to all, and this is only a sampling of what I might have shown. Philanthropy continues, and we have been recipients of some notable gifts that are listed here. Again, I would highlight that many have contributed from our faculty and staff in particular to the scholarships focused on diversity and inclusive excellence. So I'm delighted with these contributions. With regard to strategic planning, you'll recall that our strategic plan was completed in the fall of 2019, and we were busily implementing it when the pandemic struck. After a hiatus of some months, we have returned to that, and we have had working groups working on the high priority items, which are listed on the next slide. And I will just say that these cover the wide range of activities that were in the strategic plan, honed down to those given highest priority in terms of implementation. We've had working groups addressing these throughout this year. As a reminder, we are entering our accreditation cycle, and this will be a dominant activity for the school extending through 2024 when this comes to an end, hopefully with a 7-year reaccreditation. As you'll hear in the presentations to come, we have had a wide range of activities moving forward related to racism, equity, diversity, and inclusion under the leadership of Cerise Hunt, our Associate Dean of Equity, Diversity, and Inclusion, who has established an office and implemented many activities that I know many of you have participated in. I think one very helpful exercise was the leadership reading the book Cast by Isabel Wilkerson, as did the staff council. I think it provided an important opportunity and forum for discussions. Recent faculty hires have also added to the diversity of faculty at the Colorado School of Public Health. So with this, I'm going to turn to Associate Dean Lisa Miller, who will go ahead. I think actually, sorry, go back one slide. I think I missed my last slide. So my overall report card for the year, that we are doing well. And I know we are all dealing with stresses, strains, and challenges, but I'm grateful that we are doing so well across 2021. And we'll come back to that when I close. So on to you, Lisa.
Thank you, Dean Samet. So last year, our public health practice update focused on a couple of COVID-19 practice activities. One was the work that our CSU students and faculty were doing on a mask observation study on the CSU campus, which was later published in an MFWR. And then we also highlighted the COVID case investigation and contact tracing work that our students were doing at the State Health Department. And our students are still providing that really important work for the state and for our counties in our state. And to date, 129 students have been employed at one time or another throughout the pandemic to do this work. And we currently have 30 students. So the work is still important and still ongoing. However, this year we wanted to focus on a couple of other great projects that you might not be aware of and not talk about COVID for a few minutes. And these are projects that both connect research to practice. I will make one other COVID plug that we are having a public health practice seminar on February 3rd on vaccine hesitancy. So please do mark that on your calendars. So our first speaker for today will be Carol Kaufman, and Carol is a professor of community and behavioral health who conducts research with tribal communities in the school centers for American, Indian, and Alaska Native Health. And she'll be presenting on the Native Wise Choices, which is a research project that is also developed into a community resource. So Carol will be representing the team that has done this work and talk about how that happened. And then right after Carol, we'll just go into our second speaker for public health practice, and that will be Lily Tenney. You've already seen Lily's picture that the dean showed in one of his slides. Lily is an assistant professor and the associate director for outreach and programs at the Center for Health, Work, and Environment. And she's going to talk about her work on total worker health and how that is incorporated with public health practice scholarship. So with that, I'll turn it over to Carol.
Thank you, Lisa. Good afternoon, everyone. I'm here to talk with you, as Lisa mentioned, about public health practice within a research project. I'm here representing a whole team, and I would like to acknowledge them. Michelle Sarche is the other PI of this study. And next slide, please. This is the whole team, a very talented and creative group. I'd like to call a special attention to Nicole Reed and Sarah Boland. Both are DRPH students in CBH, and they developed a slide deck that I am borrowing some of those slides today. So special thank you to them. Next slide, please. So what is Native Wise Choices? This is a NIH-funded research project to test the effectiveness of a culturally adapted evidence-based program to prevent alcohol-exposed pregnancies. The population of focus here is urban Native American young women. As some of you may not know, that some 70% of Native Americans are urban, even though proportionally they're a tiny part of most urban areas. So we wanted to reach that community, and we thought we would do it in a way that these young people are so good at, using technology, phones, and social media. So it's a really pretty usual steps for a project like this. You finalize the intervention. Next. In our case, this was a phone app. Then you recruit, we thought, by social media and evaluate those RCT results. You're anticipating me. When Michelle and I wrote this grant, we were thinking a few ads on Facebook would do the trick. And we started with a few social media posts, and here we go. We're now at 3,000 followers on Instagram. Now, the irony that Instagram is right now in front of the Senate today is not lost on me. We believe, however, that our project's work presents a strong counterbalance to the destructive forces perpetuated so much on social media platforms. Indeed, we think maybe the counterbalance may have contributed to the popularity of this account. Next, please. We have even been cited in Self magazine as a resource for mental health. Now, okay, this is not exactly the American Psychological Association, but this came out of blue. Nobody contacted us. It's a sign of how word is getting around about this site. So what happened? Next slide, please. We know that Native Americans have a well-founded distrust of researchers. So our goal was really to make a space, a social media presence, offering affirmation and building out a safe place for hopefully recruitment for participating in our project. So we posted about topics that were important to this age group. And importantly, we partnered with other organizations serving Native communities and Native youth in particular. We reposted, tagged, retweeted, all sorts of things. Next slide, please. We came up with content that worked. This is one example, the Indigenize Your Life series. So indigenize all sorts of recommendations for books, for self-care, for movies, for comedians. That's been very popular. Next, please. We also created posts about current events and issues that supportive and affirms the Native community. One example here is the Olympics. This was a big hit. It was a series showcasing Indigenous women from all over the world who were competing. Topics can be very serious about murdered and Indigenous women and people, but we also celebrated Native graduates in the spring, promoted sunscreen in the summer, and showcased Native recipes at fall harvest. Next slide, please. Our social media has created for Native young women, and their engagement and following shows that our messages are important to them. This account, our Native Wise Choices, has become much more than just a recruitment tool. We are very proud to bring visibility to Native young women, sharing their stories of strength and providing resources, information, and connection. It is building community. Next slide. Thank you very much. Please reach out with questions and please follow us. Thank you.
Hello, thank you, Carol. As Lisa mentioned, my name is Lily Tunney. I'm the Director of Outreach and Programs at the Center for Health, Work and Environment. We are one of 10 centers of excellence for total worker health funded by the National Institute for Occupational Safety and Health, led by Director and Distinguished Professor Lee Newman. And practice is one of our 3 main pillars. Next slide, please. For total worker health, our practice portfolio falls under the outreach core, where I want to make sure to acknowledge we have a robust team of faculty and staff that are all working on projects that I'll mention and present just a few specific ones today, more broadly on the goal of ensuring that evidence-based total worker health approaches, guidelines, policies, best practices, or similar activities are promoted and implemented in affected populations. And the mission of our work for total worker health is to improve the safety, health, well-being, and productivity of workforces. I wanted to also point out importantly that the definition of total worker health is the policies, practices, and programs that protect workers and promote their well-being. So it's very multidisciplinary, it's transdisciplinary, and it has challenged us as a center to engage with many different stakeholders and partners in translating research to practice. So our approach is in applying dissemination and implementation strategies. We do this through, first and foremost, engaging stakeholders, including business leaders, including community partners, working with coalitions that are focused on engaging employers in public health initiatives. So what our steps are for implementation strategies or public health practice strategies are in working with stakeholders to design the content. It's a very co-creation process where we're working with different partners to identify the best components of public health practice and then the best ways to implement that. And then we're constantly tailoring and adapting that so that we're able to enhance reach and adoption and implementation. Through our public health practice, we work primarily with public health, workers' compensation insurers, industry, the business partners we have are our cornerstone to our practice portfolio. We've worked with government in specifically economic development groups that are looking at ways to not only grow local economies, but ways that those businesses operating in communities can be employers of choice by demonstrating that they're taking care of the health of their workers. And then increase, and as a result of that, at the end of the day, we're measuring our success in public health practice through increased reach to the practitioner community. And we define that by those that are doing total worker health in organizations, as well as the professionals, health educators, health and safety professionals that are providing consultation and technical assistance to those organizations. We're also looking at outcomes and increasing capacity through knowledge, through a new adoption of concepts and practices into workplaces. Next slide, please. Our approach to practice is employer facing. So the cornerstone to our practice portfolio is HealthLinks, which is a program that was developed and launched by our center in 2013. So that makes 8 years that we have partnered with and served the employer community in Colorado and in 8 additional states across the country. We, through this program, through HealthLinks, we have engaged employers in taking interest in public health and in doing public health in practice. We've developed modules specifically around disease prevention in the built environment and designing workplaces to enhance well-being of workers. We've worked with a range of stakeholders through HealthLinks in defining what language to use, what messaging to use to better reach and engage them. And we have also, as a result continued to learn how best to engage with organizations as a whole and to reach and benefit their workforces. Next slide, please. To date, HealthLinks has worked with over now 750 employers representing 440,000 workers. We have conducted 1,100 advising sessions, and these are consultations where we're working virtually through Zoom sessions with employers and representatives to provide recommendations and action planning for implementing total worker health in practice. And then I mentioned some of these deeper dive initiatives that are offered through HealthLinks, including family-friendly, mental health, chronic disease, and built environment. And I want to credit and shout out to the school for being a certified healthy workplace and for really working with us as a leader and demonstrating how we as a school are taking care of our own faculty and staff. Next slide, please. Our approach to practice is connected. Our practice connects directly with our other 2 pillars, training and research. So through the pandemic, we have engaged with partners to deliver real-time education, and these events have been complemented or have complemented our programming to HealthLinks directly. So we're able to have a bi-directional feedback loop where we're able to ask through these trainings as a follow-up what employers and professionals are looking for on special topics, including supporting remote workers, return to work, keeping complying with local public health guidance, and then following up through HealthLinks advising to provide them with guidance. Next slide, please. Lastly, our approach to practice is multidisciplinary. Our team has diverse backgrounds in communication, public health practice and engagement, and we strongly encourage creativity. This is a new project called the Human Side of Work that is launched out of our outreach core and is dedicated to capturing the faces, stories, and day-to-day lives of a diverse workforce. This work is credited to Amanda Cuiava, who's a communications specialist at the center, and who's launched a site and an Instagram feed where we are featuring these and showcasing this collection of relatable and heartfelt stories and images of workforce working generations and documenting the natural work environments to provide a glimpse into the human side of work. Next slide. HealthLink specifically, as well as our outreach core, focuses on the power of partnerships. We've partnered with, as I mentioned, local public health agencies and CDPHE to be able to serve as intermediaries for disseminating and implementing HealthLinks and our outreach, our practice projects. We've worked with a lot of professional associations and groups on campus noted here. Specifically the Depression Center in developing a workplace mental health module, and many community groups. That's a wrap. Thank you so much.
Okay, well, thank you, Dr. Kaufman and team, and Dr. Tenney, for all your efforts as it relates to practice. Now it's time, we're going to change it up a little bit, and we want to hear from you. As you all know, our Total Health Committee has encouraged all of us to prioritize self-care. And even the governor has given us an extra 12 hours of leave this year. And so we want to hear from you. What are your plans for practicing self-care? So you all should have seen a link in the Padlet. I'm going to invite everyone to click on the link. And as you go into the Padlet, you will be able to, if you click on the dot, you can post. Like for me, I'm going to get some much needed sleep. And as I post my comment, it's posted there. So we want to hear from everyone right now. What are your plans to practice self-care during this holiday break? I see vacation, snowboarding, relax, exercise. I need to add exercise to that on my list. Read a book for pleasure. Yes. I will not take my laptop on vacation. Solo hikes, unplug, so there's a lot of, they're coming in so rapidly. Being present with my kids, disconnect from email. Yes. Cook more, red wine, of course, in moderation. That'll be great. Read, journal, therapy, massage, beach. I'm going to go to the beach. Quality time with family, spend time outdoors, take my toddler to sea, and it jumped around, ski. So there's a lot of great activities. And we just wanted to take a moment because in this season, folks are experiencing pandemic fatigue, work fatigue, compassion fatigue, and it's important that you take the time to pause and really prioritize your self-care. And that's one thing as a school that we want to encourage everyone in this holiday season to shut everything down and prioritize yourself. So thank you all for engaging, and we'll go on to the next section.
Thank you so much, Cerise. What a fun way to intervene in this address today. Welcome, everyone, and thank you so much for being here. First, I'm going to present a short update section regarding education-related activities in the school, and then we'll transition to a panel of faculty, staff, and students to highlight a portion of the important EDI work that's being done in our school. Next slide, please. So here's some updates. And while my time does not allow me to share all the great work, here are some ones that I think are important. Mary Dinger has been named our new Faculty Director of Practice-Based Learning for the school. And as many of you may already know, Mary leads PBL efforts on the CU Anschutz campus and leads the Trai campus PBL team. So if you have questions about capstone practicum or any other important aspects to PBL, please reach out to Mary with your questions. We also have a brand new EDI focused course, PUBH 6625. Anti-oppressive practice and research. In this 2-credit course, students focus on identities and the relationships of those identities to power and privilege and accumulations of disadvantage. Instructors for this course are amazing: Nathifa Miller, Nicole Tuitt, Heather Kennedy, and Chrissy Chard at CSU. So please be sure to take a look at that class. We've also included 2 important statements on our syllabi, Title IX and an inclusive classroom environment statement, to go along with our new fall 2021 student course evaluation questions. These statements provide a foundation for students in understanding our Colorado SPH inclusive classroom environment, and also provide clarity on offices and mechanisms in place within our school and campuses for discussing and reporting any situations regarding discrimination, sexual misconduct, and the like. Additionally, CEF has released new 2021 criteria. Don't be alarmed. These changes are meant to provide clarification on commonly misunderstood or confusing language. There's removal of duplication and confusing language or concepts, and some streamlining of language. And as John mentioned, our reaccreditation is coming very soon, which will include us working together on our self-study to submit to CEF. We also have 2 new certificates. Next slide, please. The first one is the certificate in American Indian Alaska Native Health that's offered on the CU Anschutz campus. And then next is the rural health certificate that's offered at UNC. Next slide, please. We also have increased student enrollment. So as John previously stated, our applications to the school have increased by almost 20% in the last cycle, which equates to increased enrollment. And with increased enrollment brings increased student credit hours. So I thought that this was some information that would be really interesting that we commonly don't see. But you can see over the years by semester, the increase in our student credit hours for the school. So we really are offering a lot of opportunity for our students in the classroom with our 57 academic and certificate programs. Next slide, please. Now it's time for our panel, the best part of this segment. Today we have with us Dr. Wei Pern, who's going to represent the Department of Epidemiology's Health Equity Council. I actually will step in to provide information on the Department of Community and Behavioral Health's Anti-Racism and Equity Committee. And both Raven Cloxton from the Office of Equity, Diversity, and Inclusion and the Office of Public Health Practice, as well as MPH student in Community and Behavioral Health, Cassidy Walters, are here to discuss important EDI student-driven projects. But let's first hear from Dr. Pern.
All right. Hi, everyone. Thanks so much for the introduction. I'm here to share with you some of the goals of the Epidemiology Department's Health Equity Council, several of which have an educational focus. Next slide, please. To provide a quick background on the council, we convened in summer 2020, and we're a group of 3 faculty, including myself, Allison Abraham, and Kendra Young, 2 PhD students, Satvinder Dhaliwal and Liz Litkowski, 1 postdoc, Ellen Francis, and a staff member, Rachel Steinberg. We were charged with 6 original goals listed on this slide in black font, 4 of which we've accomplished and 2 of which are in progress. The accomplished goals include identify and invite outside speakers and researchers to discuss the intersection of health and race, organize and lead epidemiology town halls, develop and maintain an incident reporting tool or mechanism, and develop a school-wide anti-bias workshop. I'd like to emphasize the last bullet point in black text, since achievement of this goal involved a 2-part school-wide workshop to educate faculty and provide them with resources to recognize and respond to microaggressions in the classroom. The workshops were moderated by Floretta, or Flo King. Flo is a social justice trainer and educator based at CSU, and also the founder of Thriving Inclusion, which is a diversity, equity, inclusion, and justice resource for organizational and personal development. So if anyone's looking for a resource like this in terms of training in the DEI space, I highly recommend Flo and Thriving Inclusion. Now you'll notice that there are 2 goals that are halfway marked off. These are identify ways to integrate content related to racial and health equity into course epidemiology coursework, and to coordinate with other EDI groups across Colorado School Public Health departments. With respect to the former, we are currently collecting information from our faculty on what they have done, whether it's formal or informally in their classrooms, to address issues surrounding DEI so that we can learn from one another, identify gaps in our approaches, and relay our efforts to the students who have been diligent in following up on this. With respect to the other half-completed goal, we are starting to coordinate with other EDI groups at the School of Public Health, starting first with the one in CBH, which is led by Babette Greenwell, with whom we have a tentative meeting scheduled for the new year. Beyond the 6 original goals, we recently added 2 additional ones that are shown in blue text. The first is we've taken on the role of sending out statements to our department following tragic occurrences. We view these messages as a way to acknowledge the toll of these kinds of events on mental and physical well-being, and to provide resources for those who may be struggling. Then the last goal sounds a little vague, but it's one that emerged from our last council meeting. We want to increase diversity in the public health workforce by collaborating with pre-existing initiatives to support and promote underrepresented persons in research. And to this end, we are identifying opportunities to collaborate with pipelining programs and strategies to set aside RA-ships or graduate teaching opportunities to support underrepresented students and trainees in public health. So that concludes my bit about the Health Equity Council. Thank you.
Thank you so much, Dr. Pern. I'm now going to present some details about the work with the Community and Behavioral Health Anti-Racism and Equity Committee. As you can see here, the ARC committee is composed of several faculty members and students. The co-leads for this committee are Dr. Babette Greenwell and Dr. Heather Kennedy, who provide important leadership for the work that we're doing. Next slide, please. The ARC committee, while I would like to present all the information of the great work of the ARC committee, these are the 6 main priorities that are identified. For time's sake, I'm only going to focus on teaching and professional development priority areas. Next slide, please. In terms of teaching related activities, we've been engaging in important work, including addressing racial and social injustice from a strengths-based model when auditing course syllabi and modifying curriculum for both existing and new courses. We've been working on creating a syllabus rubric and guidance document and resources for faculty to translate this process to their courses, including core courses and electives. And then finally, we've been focusing on faculty course evaluations and will continue to assess inclusion of anti-racism and EDI content and the impact on the student learning experience. Next slide, please. In terms of professional development, we've been working on enhancing professional growth for faculty, and that's through a lot of self-reflection with training modules, and these happen often during faculty meetings. Training modules including unconscious bias, white supremacy culture, developing norms and use in the classroom, course syllabi auditing exercises. We've also had CBH town halls regarding racial injustice and addressing white supremacy culture. And important for faculty when they're in the classroom, we have a repository that we're continuing to collect more and more. These are online resources, podcasts, books, articles, films, etc. And then we have our last but not least CBH book club that meets monthly with faculty, staff, and students. So as I stated previously, I have an education segment piece here that's going to focus with Raven and Cassidy on the excellent student-driven projects that we have in the school, just 2 of them. So we're going to stop sharing the screen at the moment so that you can see Cassidy, Raven, and myself. And what I want to do is provide just a brief description of this work, and then ask Raven and Cassidy to provide their perspective on these projects. So with the guidance of Dr. Heather Kennedy, Dr. Chrissy Chard, Christine Musavi, Raven, myself, and several students, including Cassidy from Anschutz, UNC, and CSU, we've been working on a student-driven project that will result in the creation of a Canvas page for students and faculty on enhancing inclusivity in our Colorado School of Public Health educational environments. This project involves the creation of a series of vignettes recorded via Zoom that features students' stories, experience, and guidance on topics such as vulnerability and correct use of names and pronouns, and strategies for acknowledging and attending to power dynamics, and how not to tokenize students of color or students with other minoritized identities. Raven will represent the CSU, Colorado School of Public Health Anti-Racism Student Action Group, as they have worked also on the creation of a summer mini course that focuses on issues and nuances of race, ethnicity, sexuality, gender, socioeconomic status, sizeism, religion, and addressing systems of oppression and privilege. The mini course places an emphasis on encouraging students to adopt a critical lens as they engage in self-reflective work to acknowledge their role in becoming public health practitioners. So thank you so much for being here today, Cassidy and Raven. First of all, I was hoping you could provide us your perspective on why the project or projects you're involved with are important for you and why you wanted to be involved. And maybe we could start with Cassidy.
Thank you, Dani. So I'm thinking about why I think this project is important work. I think about how, public health schools across the entire nation are focusing more of their efforts on and resources towards increasing diversity, access, and inclusion. But a lot of these early efforts are sort of more focused on the structure of the school, research, admissions and scholarships, and as well as changes that faculty need to make in their classrooms. However, the reality though with that is that some of these changes will take months or even years to complete. And so this project is important work in my eyes because it focuses specifically on students. It provides opportunities to center students' voices and experiences. And the most unique part about this project is that with the help of our amazing facilitator, Dr. Heather Kennedy, the conversations are being led by the students themselves.
Raven, how about your perspective on the work you're doing?
Yeah, so the work of the Anti-Racism Student Action Group, as well as the Social Justice, Equity, and Inclusion team at CSU is important because overall they aim to support the Colorado SPH in becoming a program that centers anti-oppressive practices, social justice, and health equity. And then speaking specifically about the summer mini course, it was launched this past summer session in 2021. And we just saw this as an opportunity to make sure that everyone's exposed to these topics at the very start of their MPH coursework. So we're currently in the process of looking at feedback that we've received from the first cohort that had an opportunity to take this course. But being that everyone comes into the program with different experiences and lenses and positionality, this is just a great way to help everyone be more mindful about the impact that that's going to have in their public health career.
Thank you. And I think that you've kind of answered this a little bit, but how do you think this project you're involved with will help other students and faculty in moving forward with EDI focused efforts, both personally and professionally? And maybe Raven, if you could start us off with this one.
Yeah, so the group helps students and faculty to move forward with EDI focused efforts professionally by providing this really nice structure with time-bound goals for implementing our programmatic changes. On a personal note, we also have been engaging with podcasts and group reads and training and workshops that we've attended, and then always try to make space for debriefing and discussion afterward. So I think it's really helped us to create this community that's committed to this and shares those same values toward learning and unlearning.
Thank you. Cassidy, what are your thoughts on this?
Yeah, I think a lot of my, also just real quick apology for the dog barking in the background, but I would say that a lot of my thoughts are very similar to Raven, that I feel like this project is going to help students learn that first off, it's okay to be vulnerable, and that it's absolutely crucial to validate other people's lived experiences, and that it is essential for us to model these inclusive practices in the classroom so that ideally these practices will spill over into the professional work that students are currently working on or that they choose to pursue after graduation. And I think too, when thinking about faculty, some of the dialogue that will come out of these conversations will benefit faculty members in how they set up their classrooms, engage with students, and as well as how they can best support their students when it comes to inclusion efforts.
Well, thank you so very much, Dr. Pern, Cassidy, Raven, for all your thoughts, and we hope you enjoy the rest of the session.
Okay, good afternoon, everyone. It is my privilege to now present to you the research part of our session. So we've had an exciting year in research. Our external funding, next slide, please. Our external funding has increased by 2%, with a greater proportion of our funding now coming from federal sources. So here you see last year, we had funding from about $7.5 million or so to this year being just a little bit over $9 million in federally sponsored research and practice. And then in 2020, our faculty increased the number of publications by 1.5% over previous years. And we also increased the impact factor, the average impact factor of the journals in which we publish in. What's important here is to think about, sometimes we make an artificial distinction between research and practice, when in reality, this is truly artificial. It's a continuum. Sometimes we do very basic research around methods development to extremely applied research, like with our modeling work that's been done in the school. All of it with equal importance and all with the goal of improving public health and reducing disparities and inequities that are just inherent in our work, and that we uncover these things. And it's part of what we do to improve the health and lives of those around us. So what I'm going to do next is something a little different from what's been presented in the past. We have amazing, excellent centers and senior researchers. But it's important to also recognize the many faculty that we have that are new investigators. They have new awards, and not all of them are associated with centers, but they're doing incredibly exciting research. So in the next couple of minutes, I'm going to highlight some of this research that is in practice that is ongoing within our school by our faculty members, starting with HSMP. Beth McManus received her first R01 from ARC to evaluate the effectiveness of state programs to expand access to early intervention services for children with special healthcare needs. She built this from her R03 award. Lauren Nicholas, a new member of the HSMP faculty, received her second R01 from the National Institute of Aging, and she studies health and financial implications of early stage Alzheimer's disease, incredible public policy implications of how to improve health and the healthcare quality of the elderly. EOH, Katie Dickinson received the National Science Foundation grant with Courtney Welton-Mitchell to study oil and gas location, housing choices, and environmental justice in Colorado. And then Courtney received an award from NIOSH, focusing on mental health and emergency preparedness among K through 8 school workforce, and Lisa McKenzie focuses on the health effects of air pollutants and other exposures resulting from unconventional development of petroleum resources. She has an NHLBI grant to study the effects of hydraulically fractured oil and natural gas sites on atrial fibrillation. All of these research and practice projects have incredible implications for healthcare, health equity, and also health delivery and public policy. Epidemiology. Talia Quandalesi is a member of the COVID modeling team, a great example again of research to practice, and she has an NIMHD funded concerts project, which examines the factors influencing COVID-19 testing and infection rates among American Indian Alaska Native people. Thomas Janich uses crowdsourced and health surveillance data to examine the spatial temporal spread of epidemics, funded by the German Research Foundation, showing the global research or the global reach of our faculty. And Angela Lee Wen is a member of the Substance Use Disorder Prevention Working Group, Nurse Family Practitioner Partnership, to improve substance use screening and relapse prevention, a clear practice application. Community and behavioral health. Faculty include Charlotte Farwell, who has received numerous awards studying maternal mental health and mental and physical health among early childhood education caregivers. Nicole Tuitt recently received 2 major awards focusing on Black and American Indian and Alaska Native youth, an NHI-K Award studying multi-level interventions to support health equity, and an NIH R21 looking at the impact of adversity on serial development of substance use and precursors to sexual risk. And Jared Ivanich has a NIH R21 focusing on tribal reservation adolescent connections in addition to other grants. His research on the health and well-being of American Indian and Alaska Native youth. Biostatistics and informatics. Here we highlight Dr. Anna Barone, who is a long-term faculty member of our school and also received an NCI R01 grant to study the clinical utility of biomarker enhanced approach for the management of intermediate risk indeterminate pulmonary nodules, which is important for the detection or early detection of lung cancer and knowing when to treat. Next, we turn to our CSU colleagues. Jennifer Elf is in the Department of Environmental and Radiological Health Sciences and Epidemiology. She received a K Award on air pollution and cardiopulmonary health by HIV status. She's also a co-investigator on the recently funded U Award evaluating smoking cessation interventions for people with HIV in South Africa. Thank you. Megan Mueller is in the Department of Food Sciences and Human Nutrition and CBH. She received an AHA award focused on corporate social responsibility efforts in the restaurant industry and associations with business practices important to cardiovascular health. And next slide. And here we have Jude Bayham, who's part of whose research on wildfire management, infectious disease management, and the impacts of air quality in human health, and Bailey Fostick, who has developed statistical models to analyze multivariate data. Both of these researchers are key members of our modeling team for the COVID-19 spread and understanding its impact on our state. So I wish I had time to present the research of all of our faculty and the implications for practice and the importance it has in public health, not only in Colorado, but across the country and around the world, as you see from some of the global examples that I pulled out. I hope that many of you will reach out to these faculty members, grow larger teams, and to be able to enhance the research of the School of Public Health. And with that, I'm going to turn it back to Dean Samet, and thank you all for your time.
Thanks to everyone for telling such a good story about some of the many, many things that the school is doing. We can go to the next. So we're at a critical moment. Of course, I've mentioned that we are at month 22. It's been a long time since the halls have been full of faculty, staff, and students. For those of you who have not been on the 3rd floor of the Fitzsimmons building, there is new carpet. I'm hoping that we will reach a point with the pandemic and our own comfort and activities that we can all come back to the school, begin to come back and transition. I don't know exactly when that point will be. We have now the specter of Omicron, of course, as everyone knows, but hopefully as we leave the winter, we will see the pandemic abate in Colorado and everywhere, and we will be back together. I show this mug, in which I think you should be able to see mine in my hand, because we, Christine and I, who worked hard to pick out the carpet and had muttered for years about different coffee stains, are hoping that everyone, as they come back, will pick up one of these so that we will have unstained carpet for the future. But more seriously, if we can go to the next, I want to really acknowledge and thank you all for all that you have done for the school during these most challenging times. We are all grappling with many things in our professional and personal lives, and I'm pleased that so many of you have kept the school as a priority and done all the important things related to our education, practice, and research missions. I think, as you know, we've been separated. I think we have lost a feeling of community, the feeling that comes when we are together. And again, as I said, I hope that we will be able to regain that. But in the meantime, please make certain that I'm very grateful for all that you have done. So with that, on to the last slide, which is this year's holiday card from the school, a skier here bending the curve. You all have great plans for self-care, it appears. That was a wonderful exercise, Cerise. And I think what I might have said is try to do nothing. And hopefully, whatever you do, enjoy the holidays, and let's hope that 2022 brings an end to the pandemic in a way that we can get back to life as we want it to be. So thanks to all for joining today.